Okay, hi everybody. So we're going to jump in. We're right back on pace and timing here. So we're going to talk about the standardized letter of evaluation called either SLOE or SLOE. I've heard it called different things. I refer to it as the SLOE. And this is actually has been a fun topic as this has gained notoriety over time and has been studied. So there's some literature to back the usefulness of this. It was developed initially as a way to have sort of a standardized, concise, and approach to discussing an applicant, and then also to be discerning or discriminating about different characteristics of that applicant. So the goal with this when writing these is to keep comments succinct and relevant, and as it says, make efforts to avoid grade inflation in your comparisons, because we don't want to detract from the effectiveness. So it's supposed to be standardized across our students, and I'll go into this. This is just from the front website about the SLOE itself, and they recommend that a well-written SLOE provides an overall perspective on what an individual candidate offers to a training program and provides important information regarding the distinguishing non-cognitive characteristics. It should highlight strengths and explain areas of focus for the student or potential areas of improvement. And then different training programs may vary in attributes that they find make a successful candidate. This was a JGME paper that came out at the end of 2022. And essentially it was a call to action to say that we should be using these standardized letters in all specialties beyond emergency medicine, because now there's strong validity evidence for them. There is community buy-in, which is really helpful, and there's a competency-based approach to these letters. So other specialties now are looking at implementing these, and they've had a tremendous amount of success for our applicants and residencies looking at applicants. I just wanted to show the form. This is actually the form as it says up there from 2015-16. It's changed since then, and so I do have updated pictures for the newer versions. But essentially, when you go to fill this in, I'm sure people here, has anybody not done these? Cool. So this is what the form looks like when you log in, and I just want to highlight that this area, let's see if the mouse will show up on the screen here. Nope, you can't see it. Okay. The reference provided by box is something that we will sometimes modify a little bit. We'll include our clerkship directors. We will include occasionally a program director or assistant program director who may know the student depending on who we want to incorporate here. And sometimes we'll pull individual faculty members to contribute to writing a student's SLOE if that faculty member has worked with them on a large number of shifts and may be able to contribute additional information. And so our reference provided by Box can include a large group of people. And I think that when residencies are reviewing applicants, they do look at whose name is on the SLOE. So there's background information that is filled out, how long you've known the applicant, which is an important piece. Did they rotate in your emergency department? What did they get? And then this breakdown, this helps contribute to the standardization of the process. So this asks what percentage of students rotating in your emergency department received the following grades in the last academic year, to give a breakdown of some places will give more honors, more high pass, more pass, and so just to give a sense of that. This is new in the last application cycle, an entrustability scale. And so each medical student who rotates through and that we generate a SLOE for, is now asked to be rated on these entrustability measures: ability to perform focused history and physical exam, ability to generate differential, formulate a plan, perform procedures if relevant, and then recognize and manage basic emergent situations. So those EPAs are new, and that is in addition to the evaluative component this has been consistent over time, but the rating scale has changed. So instead of rating this from top third, middle third, bottom third scaling that was done previously, the update now is to do this on a numeric scale from 5 to 1, where 5 is your best candidate you've seen, and on 1 would be minimally acceptable for an EM resident, and then there's a button over here for not acceptable for an EM resident, and in these different areas: compassion, receptivity to feedback, dependability, punctuality, timeliness of responsiveness in completing administrative tasks, interpersonal communication skills with patients and family, and then interpersonal and communication skills with faculty, residents, and healthcare professionals. So trying to really hone in on characteristics that we might care about in residents that we're training. That's a good point. And then the final sort of evaluative component that's incorporated is how much guidance you anticipate the student will need in their residency training. So minimal, standard, moderate, and most, and then they define these characteristics. There is then a global assessment component. This is over here is what this, oh, I'm sorry, you can't see my mouse, I keep doing that. On that side of the screen is what this used to look like. This is the sort of updated version of it over here. So how highly would you estimate the candidate will reside on your rank list? And then out of the total students you had from last year, so if we had 14 applicants last year, we put 2 in the top 10% category, 4 in top third, 1 in middle third, and 7 in lower third. So the programs that are looking at your rankings this year know, relative to last year, what that means and where you tend to put people. And this global assessment is a tool that, or a number that residency programs evaluating applicants has said is quite a useful part of the application review. Actually, I'm just going to make another comment about that real quick. The SLOE, so in addition to having sort of more validity evidence for it and trying to expand it to other fields, it has also become increasingly useful as step 1 has become pass-fail, and programs have sort of shifted their weight of what they consider to be important parts of the application. And so the SLOE ends up being a pretty critical part for a lot of residency programs in their review of applicants. I just want to give an example of how we organize this. We have a shared Google Drive among the clerkship directors and residency directors who are part of the education team generating SLOEs for residents, or for med students, I'm sorry. And so we will have, the column with student name, and then we'll put in each of the sort of categories that they care about. So this is from a couple of years ago. Now our updated list will have the entrustment scale part, the assessment of the global assessment part as well. And then we will fill out for each student, we will discuss at a meeting where we think they fall, and then we'll populate our table that way. And so we have that information that is shared, discussed among a group, we come to consensus on that. And then when we upload this on our SLOE, we have it both in the SLOE itself, but then also we have backup available on a shared Google Drive to reference as needed. This we're going to spend a little bit of time on in breakout groups in a moment. And so this is the part where I think people can sometimes run into challenges when students aren't already sort of like all honor students and really good. Those students can be really easy to talk about, but when we encounter students that may have challenges, it can sometimes be difficult to know how we want to craft the SLOE for that student. And so we will talk about some scenarios and do that, but this is a key component, which is the written comment, where you're asked to concisely summarize applicants' overall candidacy, providing details on strengths, explain growth opportunities or lower ratings, and highlight anything else you feel like we should know. Then there's a small paragraph to fill out on institutional information. So please concisely summarize key pieces or any pieces of information regarding your rotation you deem important or necessary. You may also include information regarding special circumstances surrounding the rotation, such as changes related to COVID, institutional changes, et cetera. So this is just an example. This is what we use as an institutional statement at Michigan. So we say that this is a consensus letter with contributions from all authors who are listed in that author box. The University of Michigan Education Leadership Team has endeavored to craft SLOEs which adhere to the spirit of core guidelines and utilize all possible ranking categories. For this 2022 match cycle, we have a large, strong, and accomplished group. We've attempted to reflect their strengths and potential position on our rank list accurately with our global assessments. All the students we are writing letters for, we expect to be successful physicians. Please feel free to contact us if you have further questions. This year, students have returned to clinical care, the rotation is back to normal, and our simulation procedures and didactics are back in person. So that's one example. We have a site that students can rotate at up in Flint, Michigan, where we will comment on how we have residents come from multiple different programs, not just the university setting itself. And so our comparison on our SLOEs is not just within the institution, but between students from different institutions as we create that scale. So we'll comment on sort of unique features to that environment that the students are rotating through. When generating letters, it's important to be thoughtful about the language we're using. There are a few studies that have come out that have looked at bias in letters that we generate. And this is an increasingly important topic, or one that is gaining increased attention. I guess it's always been an important topic, but there's more and more attention to this, and there's more being published on it. One of the sort of key early papers looking at this that has since been replicated many times in different specialties is this idea that there are different types of words that we could categorize as communality terms or community-based, relationship-oriented with focus on being kind and helpful, such as words like help, eager, compassion, happy, kind, caring, friend. And then there are another categorization of terms that are commonly used, or adjectives that may be more agentic, more achievement-oriented with focus being on competent, aggressive, independent, decisive, and forceful. These words include examples like skill, strong, lead, dedication, confidence, active, intelligent, work ethic, hardworking. I'll pose as a question, what might be trends that you think might exist in letters that may relate to these words and biases, either explicit or implicit? Great, so that's a breakdown that you might predict and that has come through the literature, specifically the gender differentiation that has been seen. So female-male differentiation, the minority point is a good one. There's only one paper that has mentioned looking by underrepresented in medicine categories or minority categories, and that paper found a similar trend, but not necessarily of significance, but has not been as well studied yet, actually. But the gender difference has been, and this is also something that probably is not as well defined yet, because there's increased attention to the understanding that gender identity is more than just a binary thing of male-female, and so as we are better about incorporating our understanding of gender identity and try to be more inclusive with that, we may want to think about this not just differentiating male-female, but more broadly. And so one of the suggestions that I saw that was sort of unique in a paper was to say, should we write our letters without use of any pronouns? Should we ask students what pronouns they prefer for every single one, which is a practice we employ in Michigan. But what about the idea of removing all pronouns, and then everybody comes forward the same, and then we could eliminate this potential bias discrimination if we use they, them for every applicant, for example. However, applicants may not want that. So in any case, I bring that up just to say there's ongoing discussion about this. It is something you may see pop up in the literature, but what we know currently is that when we consider the more binary male-female differentiation, we have seen a trend of more agentic terms applied to males. So let me pose a different question. What terms might you care about more in an applicant? And that may not be a fair question, but do you think there are words that are better or worse? Or what are your thoughts on that?
I would say there are definitely words that some people are going to prefer versus others, but that could be very individual. And I think things we're going to look for in our students are things that we identify as positive. And so, some people might be more focused on the 3 a.m. or who do I want next to me at 3 a.m., whereas other people might be wanting those people who are really aggressive and going to be really independent and confident.
Great. Yeah, so we've talked about this internally at our institution as well, and I think that the conclusion we've come to is that we think probably just having a balance of these categorization of words among all applicants is probably best. And so trying to pay attention to, are we using these words in one particular group more than another, and recognizing that there are agentic things that are good and there are communality things that are good, and we probably want a balance of these, of course being accurate to the applicant, but a balance of these overall, and being attentive to that. So some other considerations, are the characteristics you're describing in the applicant relevant to the job, to EM residency training? We want to avoid invoking stereotypes, whether positive or negative, such as she is not overly emotional, as an example. Pay attention to balance of agentic and communal terms when describing applicants. Be mindful of whether descriptions of personality and interpersonal skills are relevant. So what we will do is we'll end up breaking into 3 groups. I guess 3, 3, and 3. Or just 2? We have 3 examples. Oh yeah, we'll just do tables. I got you. Yeah, table, table, table. Perfect. All right, we'll do that. So what I will have, we'll have 3 example cases. I have a QR code in a second. So we've categorized these. I don't know, we probably shouldn't have, but we did. So we have one that we consider an average student, one we consider a below average student, and one where we think there's a professionalism concern that comes out. If you notice additional elements you want to highlight in these examples, feel free. I will leave this slide up. And so the goal here is to generate, I'm gonna go back a few slides and then I'll come back to this one. So the goal here is going to be, as a group, to do this part, to generate a written narrative of an applicant based on the information you have available from this link you could pull up with the QR code. And so you want to highlight strengths, explain growth opportunities, and highlight anything else you feel like you should know about the student. And be mindful of the language you're using to describe the student. Think about how you want to present them in the SLOE with the information that you have. And these are real examples of our information sheets we'll collect on a student. And so it will have, you'll see, but it will have their like step 1 score back when they had numeric scores, or their step 2 score. It will have their clerkship grades, and then it will have some comments from the clerkship and maybe additional interests that they've expressed as well. And so using that information, generate a narrative comment for those students. So let's do this. This will be scenario 1, scenario 2, and scenario 3. And then I didn't actually test this on this projector with these all next to each other, but let me know if this works or doesn't work to pull up. It should pull up a Google Doc. Okay, cool. And that Google Doc, again, has information on the applicant. And you can type in it at the bottom if that's easiest to generate a, I guess you have your phones open, so typing may not be easy. However you want to craft a letter. We'll come back, so we'll take about 10 minutes to work on that, and then I'll ask you to share some sort of successes, challenges, and thoughts on the process. And then here, I'll leave this up, which is just the communal and agentic word examples. Okay. We will reconvene. I think I finally got this. I got this figured out over here. Okay, so scenario 1 team over here. If you had a chance to talk about it. So oh gosh, where did my browser go? Okay, there we go. So this is scenario 1. So this is a patient that we sort of pre-labeled as sort of an average student. And we have a step 1 score for this student. We have their clerkship grades, which are mostly a pretty even mix of pass and high pass. On the first EM rotation, they got a high pass, and on the second, they got a high pass with the following comments, which I'll leave up. And then they've done some research on improving naloxone for high-risk opiate abuse patients. They've been active participant in the emergency medicine interest group. So for this particular student with this information, what are some things you talked about you'd want to highlight or bring up, and what do you think?
So I think our reading of this was pretty similar. We thought this was like the good solid kind of like middle of the road student. We were trying to figure out the most effective ways to convey that. We read through this, the kind of keywords that were coming up with were like students seem like they're reliable, motivated, engaged, they respond well to feedback. There wasn't a lot of like really exemplary things for us to bring up, and so we talked about bringing up just some of the additional work mentioned at the bottom, like EM2, where like they did some work in research, they were engaged with teaming for years, or dedicated to the field, that sort of thing.
Great. Do you feel compelled to highlight that you find them particularly average, or do you think that the SLOE speaks for itself for the rest of it, or thoughts on that? What's our role in generating these and commenting on that?
I think that's kind of what our side discussion was about here, was like just the, like one of the, I'll bring it up in the group, is like one of my concerns is always using too much flourish for that middle third candidate, and like, are you overselling them, or are you just kind of, I think, you know, people can read between the lines on that, and are we, even though we're saying good things, we're not necessarily saying negative things. I don't know, is that the most appropriate way to communicate this? Whereas if you use very flat terminology, I think that tends to overwhelm the negative message to some too.
Yeah. Yeah, and in some ways, these students can be among the harder ones to write letters for because, right, you don't want to over-embellish positive traits when the rest of your application isn't reflective of that. But you do want to highlight things that might not otherwise pop out when their grades are otherwise pass and high pass. They don't look that good. So I really like your pulling out specific descriptors from the comments, and you can even use quotation marks in this to draw those out or describe that those were commonly repeated themes in their comments. And so being true to sort of your source material, which is your comments from the rotation, I think is a great way to pull in positive traits in language that's true to the applicant. And then you may decide to or not to include things that may suggest they're more average, like that they may need more guidance than your top performers in residency, or they may have some deficits in medical knowledge that may require extra attention, or whatever it may be. Or you may decide the SLOE otherwise objectively speaks for itself, and when you're placing them in these sort of like middle third categories elsewhere, and this narrative is your chance to talk about their traits that do jump forward. And you're not being disingenuous by doing that, as long as you're attentive to not being overly flourishing. And so I think some of the other examples by comparison may be helpful in that discussion. Cool, thank you. Scenario 2, this student, that was that table, I believe. This student had a step score of 205. They got all passes. Their comments are here, and additional work here. What were your discussion points and things you want to bring up?
Well, one of the big things we took away, as far as strengths, it seemed like the person was very like eager and receptive to feedback. One also mentioned maturity and communication skills. The biggest downside, which is kind of reflected throughout, is the knowledge gap. And so, I mean, we were talking about that. That was one of the things that could be bridged easiest. You know, these are certain personality traits you can't fix, whereas knowledge gap you can. But that was, yeah, we were getting caught on how to not totally or the person, you know.
Any thoughts on or examples of what language you might use to bring that forward? Okay. Yeah, and I can't remember, did that come forward in the comments that they're attentive to that? That's at least a glimmer of hope if the resident or if the student recognizes that they have deficits. The more challenging, of course, being the students who have deficits and don't recognize that they don't have deficits, or aren't receptive to feedback. So yeah, I think, I do think that we have, at least, I feel like, maybe this is a strong word, but I do feel like we have probably some obligation to really bring forward our thoughts on that and sort of the discussion points from what we know. Are they going to be receptive to feedback? There's a clear deficit here. Are they showing signs of motivation of self-learning? What are resources that might work for them versus not work for them? Do they need a smaller residency program, or would they do better in a bigger place with more mentors from different areas available, or whatever that may be? And so you can comment on what areas you think might help them be successful if they have negative parts, but also not be shy about bringing forth those negative parts. Does that make sense?
Do you guys ever tell a student, because I've never written one before, like, I don't think I'm going to be able to write you the letter that you want? Okay.
Yeah, so and this will go a little bit into the advising part, which is right after this, but we do meet with all of the students who are applying into EM, unless they surprise apply, which occasionally happens. But we meet with all of them, and part of that is expectation setting, and talking about, whether we can fairly advocate for them in this field, or think that they should consider other options as well. Yeah, that's a good question. Okay, and then scenario 3. So this student did better in step 1, 245. They got a lot of honors, a couple high passes and a pass. These are their comments. And yes, thoughts on this from this group?
Sort of, this was a student who had a professionalism concern, and I think what we all kind of discussed that people tend to sort of come up with sort of euphemisms or like vague nebulous language to describe a professionalism complaint, but not make it sound too bad. And I was sort of wondering if in these scenarios it's not better to just talk about how the student like clearly clinically is above their peers, talk about like XYZ ways that they really are excelling, and then you can say, we did receive one negative comment on this student, and then just like paste in the exact text of this negative comment, the exact thing that happened, and then you can like wrap it up with like, while the patient maybe needs additional coaching on, just like accreditations, even when they're there for low acuity complaints, we think this person will be a successful resident. I feel like rather than sort of trying to translate it into vagaries, that's then hard for program executive directors to really understand what the issue is with the student. It's better to just put in the exact professionalism concerns and let program directors sort of do with that what they will. Like they can decide, like this is something I feel comfortable tackling, or I don't want a student who, has this problem in my program, and by being more specific and sort of honest with what happened is just more helpful than just a vague thing.
We thought with being more vague, it would be kind of on the program director to look more into it and get more information about it, or even just kind of ignore this and be like, I don't even want to deal with figuring out what.
Yeah, okay, interesting. Love those thoughts and the idea of pulling in your source material again and saying, receive this concern that you want to be forthcoming about, and not being vague about it and trying to get people to guess at what is this coded language. I'm just going to ask if there's other thoughts on this.
We've all seen those where you get the vague language and then it often becomes, does anyone know the person that they can call offline?
Yep.
Figure out what it is. There's something to be said, especially if it's a professionalism complaint, like if it, I think you have to, it's more helpful for the person reading it if you give some detail as to what it is. Because otherwise, even if it was something relatively minor, it would act as a detriment to the student. Where someone might say, this one sounds like drama, I'm going to put them on, let's put in a potential problem. And on the opposite end, if it was something really big and you just sort of made some big reference, that might get missed, especially as we're all probably going to be interviewing a lot more students next year because of just our jobs in that last year. I think if you're going to put it in, then address it.
Mm-hmm.
You don't have to give all the details, but maybe give a one-line sentence.
That,
I
Right. I was going to pose that as a question as well, so thank you for bringing that up. So, right, if you have just this one comment among all of them, are you obligated to mention this, or should you, or do you leave it to somebody else?
I think the thing that makes it red flaggy to me, honestly, like we've all been frustrated with patients who show up with, their treatment like that they've had for 5 years, but I think the red flag part to me is that the student brushed it off like the penny brought it up to them. And, we've all had some experience where we don't feel as passionate as we would like to maybe hope that we would, but like, as a student, if you have attending give you feedback on something, like how many of us just like brushed it off, like, oh, I know better than this guy, right? Like that's the red flag part to me.
Yeah, so to answer your question, rather than just posing it outward again, there's a couple things we do. So one is when we see issues like this come up in the comments, we'll talk as a group, but then we will bring it to the class counselor or the dean who's generated the dean's letter and who knows the student from all their clerkships, essentially to get back to Matt's point earlier, which is to figure out, is this a pattern? And it's not our job to figure out if it's a pattern. We report this incident, and then the class counselor, whoever's tracking the student over time, then should hopefully be aware of if this is a pattern for them, and then that can make it into the dean's letter or another part of their application packet. But the other thing we do is when we generate these letters, we truly do want a consensus-based approach where we'll discuss these things and say, is this something that would be impactful to training this student as a resident? Do we think that this is something that we saw come up multiple times in the clerkship and feel compelled to let residents know? Because our reputation matters as well when we sign our name to these letters, and we want to be truthful about people who might be potentially concerning. And so if we agree as a group that we should bring it up, we will. If we think it's maybe a one-off thing, then we may not, or we may use vague language, which is probably the worst solution. And then they can call us if there's concerns. There's a comment there.
Yeah, I was just going to say that part of the way that I deal with this is I have that person versus feedback. So when this type of material comes up, it's often it's not infrequent to have comments like that are isolated or maybe more pattern, but it is a pattern that needs discussion about. Some professionals concerned that actions that they're able to perfectly modulate their behavior, set that feedback. So that's the SLOE is how they responded to not necessarily specific content, as long as it wasn't egregious. But if it was egregious,
Yeah, that's really strong. If you can comment on a problem and how they addressed it, that's great. Mm-hmm. Yep. Awesome. All right, thank you for engaging in that exercise and discussion. I think there's some really good points brought up. Yeah.
So a trend that I've noticed is that there are people that are willing to take baseline coursework if they're not willing to stay in grading. So how do you deal with feedback to a student that might go in slow that is brought to you in a grading session or in a SLOE committee but doesn't show up on? So a lot of faculty are not willing to torpedo someone's future because of a single offhand comment, but when you get it in a group and have a discussion about it, you may be able to identify a trend, but you don't have objective written documentation of it. So how do you deal with that sort of situation? Because that's something that we're dealing with a lot, especially with the program.
Yeah, I mean, we'll accept anecdotal accounts of what attendings tell us and bring those to the group discussion when we're generating the SLOE. Yeah, and so it's hard to be proactive and reach out to every attending and say, do you have any additional information? But if they came to you with something that they didn't put in writing, you either ask them to write an evaluation or we will still incorporate that if it's been said to us and if it becomes, if it's a pattern that is brought up. But that is tough, I think.
Because inevitably this happens at the clerkship level, and then it happens at the promotions and advancement level. Just last month, we had a student who failed a clerkship for professionalism and had done okay, and, well, then they decided to give him a professionalism concern instead of failing him for that, but so then like this one, he got honors for the clerkship. So I think it's a failure sometimes of your grading scheme as to how you determine what your grades are. And then every other person is like, oh yeah, I had that experience with them too. And I'm like, you can't bring up stuff. But I think if you can use those cases of things ending up being pretty egregious behaviors and everyone had a chance to intervene at some point in time along the road, and then you're doing something drastic, like, it's either getting documented on their MHPE or we put people on professionalism accreditation that they can be dismissed with one more thing. And so the goal is to provide formative feedback. If you don't document behaviors, then you can't provide formative feedback.
Be an opportunity for faculty when students have any problems with giving feedback, because everyone likes to tell people they're wonderful, but it's hard for them to tell them they're not being wonderful. And like you said, it's going to be both like your students, but also your rest of us. So if you can't give feedback to students, then you can't give it to us.
And providing that when it's beyond the clerkship, is sometimes helpful, feeling of a day for the failure. It's not really fair to the student that, well, nobody said this about you 6 months ago, and now we're going to bring it up today. So, I think using those as learning experiences for the faculty, especially when you're trying to, sometimes they're pretty egregious behaviors that come out of that. When you opens people's eyes to class for us. Because then you don't, if you have a culture that actually really values formative feedback, then you don't put in that one-off sort of situation. Because everyone needs opportunities for grace and growth along the way.
Well said.